Good evening and welcome to Let's Talk About Mental Health. I'm Nels Kloster. I'm a local psychiatrist in Southern Vermont and working with Robert Stack.
Yes, I'm Robert Stack. I'm a licensed alcohol and drug counselor. Before we get going with the show, I just want to say something that last week I saw in the trailer, that one point in the trailer about the show, I said something that I want us to have a good time. And I don't want to be mistaken that I would make fun of mental illness or drug addiction. That was not my intention, but I'm hoping that this show is really about helping people to talk about this, talk about their illness, talk about their concerns, and in some ways destigmatize the whole subject. And I think if one thing we can do, if we can learn to sort of laugh or just appreciate it, you know, we're going to cry and maybe it wouldn't hurt to laugh. So I just want to make sure I'm not misunderstood about this. You know, this is only our second show, and we're going as we go, and we'll see how it turns out. But please believe me, you know, our purpose of doing this is to try and be helpful to folks and try and see if we can make their life a little better.
Yeah, and of course you and I know we were talking about that. We've been having these kinds of conversations with each other for a few years, and you know, we realized that we're talking about having fun. We're really talking about ourselves. Be loose, be natural, rather than being taking this too seriously. Because it's really important to have a sort of well, you know, not to take yourself too seriously.
All right, we'll take the subject very serious, but not ourselves.
But not ourselves. Not ourselves. Okay. So starting off, it looks like we have a text message that came to us, and of course you can contact us by text, by email, or by phone. There was a question last week about somebody wondering if their drinking habits were considered a problem or not. Now, this question this week says, being the age of a college student, I see alcohol used in large amounts often. But what if a person chooses to get blackout drunk every time they're out drinking on weekends? How does that compare to the average alcoholic's drinking patterns? Well, I kind of like the way those words, average and alcoholic, go together.
Yeah.
Yeah, because I mean, there's so many ways that people portray themselves as alcoholics or their friends as alcoholics. Right. Like I'm a functioning alcoholic, or is the most common thing that I ever hear.
Right. I think that I did some work on the adolescent units, and one of the things I was sort of struck by is that a lot of adolescents, when they talk about their drug and alcohol use, they talk about it like they want to be wasted, wrecked, total. I mean, it's not social, it's not fun. And I'd really be worried about somebody who every time they drank on weekends they blacked out.
Yeah.
I mean, I really, I don't want to over-diagnose anybody, obviously, not knowing the person. And then I know a lot of people in college drink a lot, and they tend not to do that when they graduate from college. But I still find that sort of worrisome when I see somebody that will get to the point where the next day they don't remember where they were or what they did. That level of intoxication or drinking is really, it's a harbinger of a lot of problems to come.
Yeah, it makes you worry about sort of that kind of a goal-oriented approach to their drinking.
And they should be worried. I mean, if you wake up and you don't remember where you were last night or how you got home or what you did, I mean, the normal person would be worried. I mean, that'd be a moment of concern. And I think anybody who does that should be concerned, and if you have a friend that does that, I would say something to them. I'd worry about it.
Because some people seem to have pulling this identity from the idea that, oh, I drink this much, or get known as a person who gets blackout drunk. And another concerning piece is people who are drinking these caffeinated drinks, like Red Bull cocktails, so they can stay awake long enough to drink even more.
Right.
Which probably is not is a sign of some kind of problem developing. But like you said, the fact that they are drinking to excessive amounts, to abusively in college, doesn't necessarily mean it's going to be a lifelong problem. Mm-hmm. But it's certainly a worrisome sign.
Right. And if they didn't drink during the week and they didn't drink in school, then I'd even worry about what was so worrisome about the social situation. Mm-hmm. I mean, what you know what I mean? You wonder sometimes about that. Is there something really uncomfortable about being in that social setting? And if so, you know, why would you keep drinking to that extent? Anyway, so I would worry about it. I would say something. It's not normal, and you know, bad things happen in blackouts. And you know, you stand before a judge and say, "Gee, I don't remember." that doesn't make it.
That's not going to be a good enough
So that's
defense.
worrisome.
Right.
And it's nice to see that somebody watched our show last week.
Absolutely. We have at least one fan going here.
All right, here we go.
So now this one comes from an email. I lost my job, my wife divorced me, and took the kids. Some days I can't even get out of bed. I know I need to look for another job because the bills are piling up and now I can't even pay the rent. But I barely have the energy to go buy a newspaper. I feel like I'm drowning. Wow, that's a lot going on at one time.
Yeah.
Yeah, it sounds like the whole world just sort of crumbling apart there.
Right, and I think it's probably appropriate that you feel sad, and you're sort of worried. I mean, everything you've lost your job, and one of the worries sometimes around suicide sometimes is loss of job, loss of family, loss of sense of self, and that thing about not getting out of bed. Sometimes that's a hallmark of depression, but I wouldn't leap to that necessarily.
No, I mean, because with all these things happening. Often people say, I'm depressed, I'm sad, I can't do it. I'm thinking, of course you are. That is so natural. I mean, just losing your job would cause you to be sad and depressed. Divorcing certainly would do that. To be without your kids if you're a family man. And men maybe more so than women, but a lot of us gain our identity from our work. And when that's taken away from us, that's really a big blow to the ego. Right. So with a question like this, like you were hinting at, I'd be much more concerned if you were not very depressed. Right. And this might actually be a good sort of response initially that, this is too much. I'm going to bed, and when I'm ready, I'm going to try to deal with this. And I guess the question might be, how will you know when you're ready? How will you know when this is going on too long?
Right. And the other thing, I'd be careful about not trying to do it by yourself. Yeah. Call a friend, talk to a pastor, talk to somebody in your church, talk to a member of the family. Let somebody know that you're struggling. I mean, I think that always makes a huge difference. And also, I guess it would be worth taking a look at, why do these two things happen at the same time? Mm-hmm. Are they interconnected? Are the causes the same? Are they separate things that have happened? I mean, there's probably more to learn about that. There's probably more to be done. And so I guess I would say, go talk to someone, besides us. Reach out to somebody else and talk to them about what's going on. I think your sadness and everything is appropriate, but I'd be worried about it. I'd be worried about what were the causes and where do you go from here.
Yeah, and a lot of time, again, this, not to give the names, but this was written by a man. And a lot of time, guys are not willing to show vulnerability and to reach out to other people when they've had such serious things happen to them.
Right.
And I'm hearing you say, man, don't do this alone. This is too much. It's too serious. And another set of eyes, somebody from the outside looking at this situation and giving you some thoughts about how this might have come to be and what you might be able to do constructively around this.
Right. I mean, I just recently lost my job, so I have some idea about it.
A little bit of empathy here for this, right?
And you wake up in the morning and you're sort of worried. You're like, oh my God, what am I going to do and what's going to happen? And so, I'm hoping it will pass.
Yeah.
Look in the paper. But again, I guess I wouldn't do it alone. I guess I would talk to somebody, and I would see if those two things were interrelated. I think that's probably enough.
Because that would be incredibly bad luck.
Yeah, there's probably something else going on. And please be, don't, like I said, reach out and talk to somebody. Yeah.
Okay, good. So this one comes as an email. It sounds like from a concerned mother. My son has schizophrenia, a diagnosis he has had for almost 15 years. Every few years he stops taking his medication and ends up in the hospital. We've tried everything from giving him his meds to admitting him to long-term programs, yet he always seems to find ways to fool us until it's too late. He seems to be able to fool us for months until he takes a nosedive. What can we do to stop this cycle from happening over and over? Yeah, I wish that wasn't something I heard over and over, especially being associated with schizophrenia, but with mental illness in general. This is not just a problem with schizophrenia.
But it needs to, I think the word that you jump out there is the we. And he really needs to take ownership of his illness. Yeah. And what we're hearing here is the parents are. And I know the Joslin Clinic with diabetes, the juvenile diabetes, parents try and regulate the kid's diet and everything. And yet the best results is when the kid takes over care of his diet and takes ownership of his illness and begins to, recognize, by taking care of my diabetes, I can have a full life. I can play sports, I can do things, I can stay out of hospital. So I think in some ways this happens. Sometimes parents parents, well-meaning, but they get over-involved and they sort of, I mean, the idea that he's fooling them, you know what I mean, around his medicine. I assume he's an adult. I mean, it sounds like he's an adult.
There's some roles here.
Yeah, and you got to sort of be careful about that. And it's so heartbreaking to see him sick. And you say, you got to take your meds, you got to take your meds. But I think when it gets to that point where they're fooling you,
there's a certain dynamic, there's a certain relationship that's going on there.
And I think the National Alliance for the Mentally Ill would be a great outfit to turn to. I mean, NAMI they're here at the retreat. I know they're here in town, and they really can offer support to family members. I mean, so you not only have the chronic illness that he has, but they also will have this chronic illness, only in a different way. And just like he needs to take ownership and live with it, they need to take their own ownership and live with it.
Right. How do we respond to this? Because part of this question too, I mean, saying that it's been 15 years now since the diagnosis, we're talking about someone who is in their adulthood.
Right.
This person is probably 25 at the youngest, probably closer to 30, 35 even.
Yeah.
And the fact that this cycle keeps on happening speaks to a lack of sort of ownership for the illness. But an interesting thing with schizophrenia is there's this facet of thinking nothing's wrong with you, that there's something wrong with everybody else. This sort of lack of awareness of the illness. And I've often made the mistake myself early on in my career thinking, well, you have schizophrenia. You need to take your medications to have better control of your schizophrenia. A lot of people with schizophrenia, if not most, they don't want to hear it that way. So finding some kind of hook or some kind of way around living with this illness and then talking about treatments that help and making those of value to him. Like, so for example, maybe if he takes his medications, he stays out of the hospital, and he doesn't like being in the hospital because of the restrictions of his freedom. Then in that way, medication and stopping the hospital are connected, which is a goal that's good for him, whereas remission of the symptoms might be something he has no interest in whatsoever.
Right. And I think with chronic illness, chronic mental, especially severe, schizophrenia being one of the more severe, frequent hospitalizations are not an indication of failure. Right. I mean, they might be just an indication of severity of the illness.
Yeah.
I mean, quite frankly, I think on some level, and the idea of taking meds, and I've said this in other cases, but we sometimes suggest to people that they take medication because it's making a mess, and we want them not to make, you know what I mean? Like, take your meds. Yeah. But for the person taking the meds, they don't feel good on them. Right. Or they don't feel right, or they feel something wrong, or they feel, even that idea, side effects, makes it sound like, well, it's just something on the side. But it's not. It's how you feel about yourself. So, I don't want to offer any excuses for not taking your meds, but there does come a point where you need to talk with a doctor about medication holidays, or you need to talk about changing the dose or trying the different meds. There's all different meds that have come out. Yeah. If it's side effects that are bothering them or something else is worrying them. I just want to say that I have compassion for people with schizophrenia, and I have compassion for their families. Right. It's a horrible disease. It's a horrible illness.
And I want to sort of add in on what you said about hospitalization is not a failure.
Right.
These illnesses, they have a waxing and waning to them. Times they're more severe, times when they're in better control. And really what hospitalization really means is there's a time when the illness has gotten severe enough that a hospital is a necessity. If this is somebody with a heart condition who has failing heart and was put in the hospital to treat that, you don't consider that a failure. You consider it a necessary treatment to ensure continued life and wellness. So again, different periods in the illness require different levels of treatment. Right. Most often we hope it's the outpatient level. Other times it becomes the level of the hospital. And it sounds like the family is considering what would be something in between there that might bring some long-term benefit and relief.
And one last thing on medication, they found, and this is some research that was done up in UVM, I think, but they call it contingency rewards for taking your meds. Right. Yeah. And you wonder if that might not work. But again, you don't want to make a game of it. I mean, fooling and stuff. But is there a way to sort of build in rewards for medication compliance? If there's a test being done, if it's the level of medication is appropriate, is there sort of a sense not only of accomplishment of taking your meds, which is sort of, I'm not real proud of taking my blood pressure every day, but the idea that I'm healthy, the idea that I'm fit, the idea that I'm doing okay, I feel pretty good about. So I would try to identify maybe some secondary gains from taking your medicine and glorify them a little bit. You know, make them a little bit more important and making them more valuable. Taking your meds and watching TV, or taking your meds and not enjoying life, I mean, that's not a great argument for them.
And again, like with the previous question, don't do this by yourself. This is not something that most families are equipped to take care of. And typically schizophrenia, you're talking about, you know, community mental health centers, and in our area, HCRS, and other areas, there are other community mental health centers, but it really requires a team to be able to help people with schizophrenia to remain healthy.
And I don't know what he's like when he's off his meds. And family members are most at risk when sometimes folks go off their meds. So you do have to be careful about that. You do have to be careful and not assume that you're automatically safe just because you're family.
Right.
I mean, sometimes you need to be careful about that. Okay? Does that sound all right?
That sounds good. I hope that helps.
All right. Okay.
I hope that helped. So very, I wonder, this is like a trick question here, Robert. This comes as a text message. Do drugs cause addiction? Well, where do we start?
Well, you can't have them without them.
Yes might be the easy one there, huh?
To be an alcoholic, you have to drink. You know, contrary to common belief. But addiction is when there's certain criteria, symptoms that we use for a diagnosis, and it's when you had these symptoms of behavior, when they begin to interfere with your life, when they begin to come center stage. And the drugs themselves are wonderful. I mean, for instance, some of the opiates were developed for end-stage cancer patients who are in incredible pain. And if they took the drugs as prescribed, it made the quality of life better. And so the drugs are not the problem. The problem is the addict's brain. That's the problem. And I think in some cases people get a little, they tend to talk too much about the drug, because again, the drug is sort of neutral. I mean, it has properties and stuff, and there's the appropriate uses of it. It's really the person who's using the drug and the way they use it, and how it takes over their life, and that's really what addiction is. I mean, in the beginning you take it voluntarily, but at the end the drug takes you. And
they tie into, the receptors in the brain.
Right.
That if these drugs didn't fit into them and turn them on, then we wouldn't have that problem. So in a way, hijacking what are natural systems in the brain. Maybe an interesting spin on this is I've heard a fellow who comes from a family full of alcoholics, who's been able to sort of look at his parents and uncles and older brothers and say, wow, you know what? I think I could very easily be an alcoholic based on all this. And so he doesn't drink. And when asked if he's an alcoholic, he just says, not yet. Meaning they recognize that risk. There's something maybe that underlies our response to these sorts of these drugs, these substances, that give us a clue that it's the combination of the drug in our brain and these then out of control behaviors that together make addiction, but don't necessarily make us completely safe.
Right, and I think two of the most powerful drugs, I mean many of them, but alcohol and opiates are so powerful. And if there's something wrong psychologically, if there's something missing emotionally, whatever it might be, spiritually, whatever it is.
Yeah, some kind of void.
And it fills that void. And not only does it fill that void, but it just not only makes you feel good, but it just, you hear sometimes alcoholics and addicts talk about, I never felt that good. I felt complete.
It turned a switch.
Yeah, and it almost becomes irresistible. Yeah. And again, so yes, the drug has something to do with it. I mean, obviously, any drug that takes away pain and makes you feel good is addictive. It's highly addictive. Yeah. You need to be careful around it. But people don't abuse Novocaine. Novocaine kills pain, but it doesn't get you high. Yeah. But any drug that does both, and then for some people, it's a deadly combination. You take away my concerns and my worries and my pain, and you make me feel good about myself. Yeah. And for that,
that sounds like the beginning of a love affair.
Yeah, so but again, it's not so much the drug. I don't think there's just like not all situations cause trauma. Not all situations call PTSD.
Right.
The guy that called earlier, it's no guarantee he has depression. He could be just sad and things are going.
This could be natural.
Right. So you can't really tell, like, okay, if I do these drugs, I'll become a drug addict. It really depends. There's genetic factors. There's all kinds of things.
Yeah, because there's that notion that some drugs are so powerful, like methamphetamine or heroin, that all you have to do is try it and you're done. You're hooked, you're addicted. And that's a falsehood. It's really a combination of nature and nurture. We used to argue about in the past. Now we talk about genes and environment, and they each play a role. Right. Neither one of these alone, for most cases, completely dictates where this is going to go. It's usually a combination of the two factors.
What you were saying earlier, genetically. If you have a family of addicts in your family, and you're out with your kids, and you're 13 years old, 14 years old, and you get a chance to do drugs, that could be the beginning of your drug career. Yeah. And I can't tell you how many addicts and alcoholics I've worked with who told me, I grew up with alcoholic parents, I swore I would never be like them, and as soon as I took that drug, I turned out to be just like them.
Yeah.
I mean, so you do have to be careful, and it's not so much the drug. Again, it's you.
Yeah, absolutely.
And you have risk factors. And that's the problem, I think, sometimes when you make drugs really available to everybody, because some people are more at risk for addiction than others. Yeah. And so anyway, that's a good question.
And we all want to feel good. We all want to feel good. So another question is, 4 years ago, my GP or primary care doctor gave me Xanax for my anxiety. I find I have to take higher doses to keep my anxiety at bay. Now my doctor wants me to taper down my usage and won't give me any prescriptions for the amount I need just to be able to function. The very thought sends me into a tailspin. Since I started on the lower doses, I began drinking wine to calm my nerves. I know I shouldn't mix Xanax with alcohol, but I don't know what else to do. How else can I deal with my anxiety? Wow, this sounds like trouble on the way, doesn't it?
Yeah.
I think, one... Again, not to get too really, scientific about this, but Xanax and alcohol work at the same receptors in the brain. So one way that I look at this when people tell me about Xanax problems or being alcoholic but also prescribe Xanax, is that you could consider Xanax to be a pill form of alcohol, or you could consider alcohol to be a liquid form of Xanax. So they're working at the same receptors. So part of the reason why you get this warning about not combining the two of these is because you really sort of overload that system, and then the potential for memory impairment, intoxication, really increases, because in essence you might be drinking, taking twice as much as you normally do.
Right. Yeah. And I think the thing that's sort of, as you know, I sort of believe in this cognitive behavioral therapy.
Oh yeah.
I'm a big believer, and at some levels, Xanax and Ativan and all them Klonopin, they're great drugs. They take away your symptoms.
They work really,
they do
really
work.
well.
They work really well, but they don't do anything for your anxiety. Yeah. And over time, you'll actually become, not only have your original anxiety, but you'll be anxious about whether or not you have enough drugs. Mm-hmm. And then if you go to take off the drugs, you'll have anxiety from withdrawal. And plus your original anxiety. Yeah. And so I really, if I had to pick a phrase, it would be, how do I need to function?
Right.
And I'm a firm believer that in some ways you can begin to take a look at some of your belief systems and realize that some of your anxiety is not necessarily based on external events. It's really based more on the way you interpret your life,
how you
your
respond
to it. And I would find a good therapist, and whether it's HCRS at a retreat or somebody. I go online, and I would sort of take a look and see if there was some. There's some excellent workbooks out there. You can find them on working on anxiety.
Right. Self-help.
I do. I like it. I think on some level. They don't do as great a job with the symptoms, but over time you'll be able to recognize your symptoms. Everybody has maybe a panic once in a while, but panic disorder is the fear of having a panic attack.
Right, it gets to be a piece of it.
That's right. And one time I went to the emergency room, so I was having a heart attack, and it turned out, no, I was so embarrassed. They told me, no, your
heart's fine.
Yeah. And it was like so embarrassing, but now I sort of know. And I've been told, no, you're just anxious, you're worried.
Yeah.
And then I have some techniques that I've learned, but mostly I just talk to myself.
Right.
Once I know it's just anxiety, then I sort of recognize it.
Well, it's the kind of talk you have with yourself.
That's right.
As opposed to oh my God, the world is ending, I'm going to die
Right.
from this anxiety, you start to reframe those ideas, which is really the very important piece of cognitive behavior therapy.
Right. And it's like when, you know, when LSD first came out, everybody went to the emergency room, you know, like, oh my God, you know, and then people say, well, no, it's your LSD. You know, if you're ever on a trip, you know, you say, well, it's my LSD. This is
This
what
will
it
pass.
is. This will pass.
This will pass. Yeah. And two, maybe a little oversimplistic, but when I look at sort of your medications, I mean, alcohol, Xanax, you know, very quick acting substances, each of those. I think about the expression teaching a person to fish they eat for a day. I'm sorry, giving them a fish they eat for a day and teaching someone to fish they eat for a lifetime. And I think that quite often with alcohol, with medications like the benzodiazepines, which is the group that Xanax comes from, that we're often sort of being given a fish. In a way, we're sort of taking away the anxiety, and it stops us from taking a more long-term, productive, self-sufficient approach. That is exactly what cognitive behavioral therapy is, or CBT for short. That you learn how to reframe these ideas, to recognize what this means when you're anxious, to recognize the connection of the thoughts and the feelings, and then by examining those, reworking them, to get some mastery over this, and no longer be a slave to your anxiety, your panic.
And one last thing to the person with the question, you know, this wine and Xanax is really dangerous. I mean, I guess I feel like saying cut it out.
Cut it out.
But it is.
But a piece too, as you start to cut it out, this is going to be hard. You're going to have a rebound of those symptoms. The Xanax, the alcohol, they kind of dampen them down. Unfortunately, they work very quickly, and they dampen them down quickly. And then what happens with a lot of people is they come back and call a rebound with a vengeance, even worse than they did.
Yeah.
So going slowly helps to decrease that discomfort. And I would just caution some patience, but also put out the expectation that yes, this can be uncomfortable. And don't expect it to go without any kind of discomfort at all, because then you'll be doing yourself, you're making it harder for yourself to do this. And there must be some reason why your doctor is talking about this with you to do this thing.
And I would go back to your doctor and tell him what you're doing. I mean, I would have another discussion with him. I would say, listen, you know, I'm real scared, and my drinking has increased, and I'm really worried about it, and you know, what can we do? And you know, get another referral. But
and that's going to be hard.
Yes.
Right. That's going to be hard.
But just the fact that they would call in here or text in here, I think the person knows this is worrisome. I think they know this is something they need to treat.
Right.
And I think I would go back and talk to the doctor. But I'd be, you know, if you're on a lot of benzos and they're taping you down, then you don't have to worry about the withdrawal factor of benzos, which is really scary.
There are ways to get around
But
that.
you don't like the fact that wine could increase pretty dramatically. And you may at one point take too much of one or something.
Right. Because in a way, as that Xanax is going down, the wine is going up. It's actually maintaining the same sort of load in that system that is not the purpose that you and the doctor appear to be working towards.
I would look into some talk therapy and maybe see if I could find some peace or something. Well, I tell you, time goes by.
I can't believe that's already been a half hour here.
And you know, this is our second show. We're trying to do this, and we want to thank everybody who called in. And one of the things I wanted to say just at the end here, I wish I could quote who the person was, and this is a paraphrase. But one of the things I would like people to do is just, you know, I read somewhere one day that if there's only one prayer that you can say today, let that prayer be thank you. I can't tell you how important I think it is to be grateful for what we have, and to be thankful. And so I guess I'll just say thank you very much, and good night.
Yeah, absolutely. Thankful for this opportunity, and thankful too for any kind of comments we might get either through the show or in the community, as you see us either at the post office, the bakery, or wherever you happen to bump into us. We'd be grateful.
As long as they're kind comments, I mean, you know.
Or if you don't like the show, just say, I saw the show.
Good night.
Okay.